little bit about the evolving quality of your practice now that all the injectables have come up? A lot of plastic surgeons at first sort of resisted the Restylane, Botox injectables. Plastic surgery offices in many places in America have almost evolved into spas, if I use the right term. And how did you, was there a perception amongst plastic surgeons that since family doctors are doing this, nurses are doing it, they have it done in the malls, that this was somehow diminishing the appearance of their practice?
Well, that's another good question, and unfortunately it would take quite a while to answer the way you asked the question, because I have about 6 questions in one question.
Okay, well, that's why you're here. You have to clarify.
I'm going to try to see whether I can give you a succinct answer. We do have a MediSpa in my office as part of it. And this MediSpa, they will have endomology and light chemical peels and epilation, which means hair removal, and a bunch of other things that we do. But it's under my strict control. That's very different from going to a mall.
They have that in malls now, right?
They do have them in malls, but it's very different. Because in malls, there may be from a distance some MD, not necessarily even a plastic surgeon, who is the director of the MediSpa. He's not available necessarily there physically, but short of him being on board in some way, Restylane, Botox, etc. cannot be ordered, but it can legally be injected, at least in some states, and California is such a state, by nurses and physician's assistants. And of course by emergency room doctors and everybody else. So because of this, as you said at the beginning of your question, there were some plastic surgeons that were kind of staying away from doing the injectables. But the best trained guys look at the injectables as an adjunct or complementary procedure to the surgery. Doesn't mean surgery has to be performed every time.
They're not mutually exclusive. People come in and say, I don't really know if I need a facelift, but can I just get some peel? And you say, well, yes, we can do that, but then if we combine the facelift with a peel, then that might give you the best result.
Yeah, but it doesn't always have to be combined. This is the point. Patient comes here for a consultation. We really examine the patient's face, body, whatever we are doing, and then we may say, no, you don't need a facelift yet. Let me just use some fillers, let me use some Botox, and maybe some years from now you may want to have a facelift. Or they may come in for a cheek augmentation, say, I don't know what I'm going to exactly look like. So we may use an injectable to imitate the effect of a cheek augmentation, which eventually is going to dissipate. Then the patient could come back again for injectables, knowing it's not permanent, or may decide to have a cheek augmentation. So the way to look at injectables, in my mind at least, if you go to a plastic surgeon's office as opposed to a mall or to a dentist injecting Botox or whatever, you're going to somebody who has in his possession, in his toolbox, all the possible tools and methods that he can use. He's not limited to injectables because he cannot do surgery. So if he is indeed honorable and honest surgeon, which by far, or most of our colleagues are, especially the ones who are board certified and the members of the American Society for Aesthetic Plastic Surgery, they will honestly evaluate you and say, in your case, I would do this at this point. But he has the option to choose between the different methods of treatment for each patient. And that could be just injectables, or could be injectables combined with surgery, or any kind of combination.